Tinnitus, that persistent ringing, buzzing, or hissing in the ears, is a surprisingly common phenomenon. Often perceived as a minor annoyance, it can significantly impact an individual's quality of life, affecting sleep, concentration, and overall well-being. Imagine a constant hum in your ears, a phantom noise that only you can hear. This is the reality for millions of people experiencing tinnitus. While it's often associated with hearing loss, tinnitus can affect individuals with normal hearing as well. Its presence can range from a mild, occasional buzz to a constant, debilitating roar. Fortunately, advancements in understanding and managing tinnitus offer hope for relief. From sound therapy to cognitive behavioral techniques and innovative devices, various options are available to help individuals cope with this challenging condition. By exploring these options and seeking professional guidance, those experiencing tinnitus can regain control over their auditory experiences and improve their overall quality of life. Tinnitus is the perception of sound in one or both ears when no external sound source is present. This phantom noise can manifest as ringing, buzzing, hissing, clicking, or whistling. The sound varies in pitch and loudness, from a whisper to a roar. The experience is unique to each individual, making diagnosis complex. It's a symptom, often indicating an underlying condition. Tinnitus can affect sleep, concentration, and emotional well-being. Various treatments help manage symptoms and improve quality of life. Tinnitus can be broadly classified into two categories: temporary and chronic. Temporary tinnitus is typically short-lived, often resolving within a few hours or days. It's commonly experienced after exposure to loud noises, such as attending a concert or using power tools without hearing protection. Chronic tinnitus, on the other hand, persists for more than 6 months and can even last a lifetime. Chronic tinnitus can stem from various underlying causes, including age-related hearing loss, ear infections, and certain medical conditions. Consider the example of attending a loud concert. The ringing in your ears after the show is a common experience of temporary tinnitus. However, if the ringing persists or becomes a recurring issue, it could indicate a more serious underlying problem and warrants professional evaluation. If tinnitus persists even after an infection has subsided, it's essential to consult a healthcare professional to rule out any underlying ear or hearing-related issues. Temporary tinnitus can be triggered by a variety of factors, often related to exposure to loud noises. Attending concerts, sporting events, or using power tools without proper hearing protection can temporarily damage the delicate hair cells in the inner ear, leading to tinnitus. Another common cause of temporary tinnitus is earwax buildup. Excessive earwax can block the ear canal, putting pressure on the eardrum and interfering with sound transmission. Certain medications such as aspirin, ibuprofen, and some antibiotics can also trigger temporary tinnitus as a side effect. This type of tinnitus is usually dose-dependent and resolves once the medication is discontinued. Stress and anxiety can also contribute to temporary tinnitus. Managing stress through relaxation techniques, such as deep breathing exercises or yoga, can help alleviate tinnitus symptoms. If you experience tinnitus while taking medication, it's important to inform your doctor, who may adjust the dosage or switch to an alternative medication. Persistent ringing, when to seek professional help. If tinnitus persists for more than a few days or is accompanied by other symptoms, it's crucial to seek professional medical advice. A healthcare professional, such as an audiologist or otolaryngologist, ENT doctor, can conduct a thorough evaluation to determine the underlying cause of the tinnitus and recommend appropriate treatment options. Ignoring persistent tinnitus can delay diagnosis and potentially worsen the condition. Several signs indicate the need for immediate medical attention. If tinnitus is accompanied by hearing loss, dizziness, balance problems, or severe ear pain, it's essential to seek prompt medical evaluation. During the medical evaluation, the doctor will take a detailed medical history, including any exposure to loud noises, medications, and other relevant factors. Hearing tests may be conducted to assess the extent of any hearing loss and identify any underlying auditory issues. Early diagnosis and intervention are crucial for improving outcomes and minimizing the impact of tinnitus on daily life. Managing the hum treatment options for chronic tinnitus. While there's no single cure for chronic tinnitus, various treatment options are available to help manage its symptoms and improve quality of life. These treatments aim to reduce the perceived loudness of the tinnitus, improve sleep quality, and address the emotional distress associated with the condition. Sound therapy is a common approach to managing tinnitus. It involves using external sounds to mask or distract from the tinnitus perception. Cognitive behavioral therapy, or CBT, is another effective treatment option for chronic tinnitus. CBT helps individuals identify and change negative thought patterns and behaviors associated with tinnitus. In some cases, medication may be prescribed to manage underlying conditions contributing to tinnitus, such as anxiety or depression. It's important to discuss the potential benefits and risks of medication with a healthcare professional. Sound therapy, retraining the brain to tune out the noise. Sound therapy is a widely used method for managing tinnitus. It uses external sounds to mask or distract from tinnitus, retraining the brain to tune out the noise. Options range from white noise machines to specialized tinnitus maskers and mobile apps. White noise machines generate soothing sounds to help mask tinnitus. Nature sounds like ocean waves or rainfall can also be effective. Tinnitus maskers generate sounds matching the tinnitus frequency, providing relief. The goal is to reduce tinnitus's perceived loudness and make it less intrusive. Cognitive behavioral therapy, addressing the emotional impact. Cognitive behavioral therapy, or CBT, is a type of psychotherapy that focuses on the interplay between thoughts, feelings, and behaviors. In the context of tinnitus management, CBT aims to help individuals identify and change negative thought patterns and behaviors associated with their tinnitus. It equips them with coping mechanisms to manage the emotional distress and improve their overall quality of life. CBT for tinnitus involves working with a therapist to explore the individual's thoughts and feelings about their tinnitus. The therapist helps identify negative thought patterns, such as catastrophizing or focusing excessively on the tinnitus, and challenges these thoughts with more realistic and balanced perspectives. CBT also teaches practical coping skills to manage tinnitus-related challenges. By addressing the emotional and behavioral aspects of tinnitus, CBT empowers individuals to regain control over their lives and reduce the impact of tinnitus on their well-being. Hearing aids and other devices. Amplifying silence. Hearing aids are primarily designed to amplify sounds for individuals with hearing loss. However, they can also be beneficial for some people with tinnitus, particularly those with underlying hearing loss. By amplifying external sounds, hearing aids can help mask the tinnitus and make it less noticeable. Besides hearing aids, other devices can be helpful in managing tinnitus. Tinnitus maskers, as mentioned earlier, are specifically designed to generate sounds that match the individual's tinnitus frequency and pitch, providing targeted relief. Cochlear implants, while typically used for severe to profound hearing loss, can also provide tinnitus relief for some individuals. The choice of device depends on the individual's specific needs and the underlying cause of their tinnitus. A healthcare professional, such as an audiologist or ENT doctor, can assess the individual's hearing and tinnitus characteristics and recommend the most appropriate device. Seeking support and embracing hope. A final word on tinnitus. Living with tinnitus can be challenging, but it's essential to remember that you are not alone. Millions of people experience tinnitus, and various resources and support systems are available to help you cope with this condition. Seeking support from healthcare professionals, support groups, and online communities can provide valuable information, coping strategies, and a sense of community. Remember that while there's no single cure for tinnitus, various treatments and management strategies can significantly improve your quality of life. Don't hesitate to seek professional medical advice if you're experiencing persistent tinnitus. An early diagnosis and intervention can make a substantial difference in managing your symptoms and minimizing the impact of tinnitus on your daily life. With the right support and management strategies, you can effectively manage your tinnitus and improve your overall well-being.